Okay, off you go.
Good evening, one and all. I am Dr. Vinod. We have with us Dr. Saravanan. Dr. Saravanan is a cardiologist at the Baptist Hospital, and I am Dr. Vinod, a physician in Baptist Hospital. So today we have a very nice topic called as hypertension, which can lead to heart failure. So this is an upcoming topic. Blood pressure of most patients are undetected and undiagnosed. So we thought we should discuss on this today. And especially this is going to be an interactive session today, where we are open for answering all your questions and queries regarding elevated BP and complications related to that. So with undue delay, we will start off right in the short time. For the next half an hour, we will be discussing on this topic. So Dr. Saravanan, what do you want to tell about elevated blood pressure?
Good evening, all of you. Thanks for joining us this evening. Thanks for taking your time to join us. This is an interactive session. Please put your questions across. We will answer as much as possible today. The reason why this topic is very important is because high blood pressure almost never causes any symptoms until it results in a catastrophic consequence, which is usually either a stroke, heart attack, or kidney failure or heart failure. These are very serious conditions, and high blood pressure leads to these conditions if undetected. A lot of high blood pressure is undetected. A lot of people out there have high blood pressure not knowing they have it, and therefore it is very important to check your blood pressure at least once a year to make sure that you don't have high blood pressure. And if you did, if we identify that and treat it in good time, we can prevent all these four things that I mentioned: heart failure, heart attack, stroke. All of that can be prevented if we treat the high blood pressure in good time. Therefore, it's very important. Heart failure is a situation where your heart becomes very weak, and as a result, you are unable to do the day-to-day activities. You become wheelchair bound, and you are reliant on somebody else to do your everyday chores for you. So it becomes quite a liability as well as a serious condition, which has got a very bad outcome if not treated very well. And they are both linked to each other, and a lot of high blood pressure patients, when they don't know they have high blood pressure, they end up in this condition called heart failure. So today's evening discussion is going to be predominantly on high blood pressure, and also a little bit on its consequence, common consequence, which is heart failure.
Okay. Thank you, Dr. Saravanan. Can you tell me a little more why you've chosen the topic of hypertension causing heart failure? Do we have any statistics on how severe the situation is, how bad it is, or how undetected the situations can go to?
Absolutely. There are two main reasons. One is heart failure, as I mentioned, is a condition where the heart becomes weak, and the only permanent solution for that is a new heart transplant. Not everybody can get it. It progressively gets weaker, and at one point the heart will completely stop, which is end of life. And this is becoming increasingly prevalent in India. More than being prevalent, it is being more prevalent in younger age group. We are 20 years younger in comparison to Western world. In Western world, the peak incidence of heart failure is in their mid 60s and 70s. For us, it's mid 40s and 50s, which is a huge worry, because the outcome after diagnosis of a heart failure is that half the people will not be in this planet Earth at 5 years. So that is a very serious condition. So if we don't identify early and treat it, then we will have missed the opportunity to prevent a serious consequence, with life-threatening problem. That's one thing. The other thing is that undetected high blood pressure, even in the Western world, is very high. In India, because we do not have a habit of going for a regular health checkup, it's catching up very nicely now. There are, in urban at least, in cities like Bangalore and Chennai, people are coming for regular health checkups, but it's not common in rural areas because people cannot afford to do that. They just go to their daily work. If they have to go and wait in a doctor's surgery for 1.5 a day, it's both expensive for them to do that and the loss of earning that day. So it is very important for them to not lose that. But at the same time, it's also important to identify the condition. Because of this undetected problem that is prevalent all across India and about 1.4 billion people, it's quite prevalent among them. It is going to lead, and it is increasingly leading to a lot of young people having heart failure. They come to us at the point of heart failure, which is why I thought it's very important to identify this. People are always worried about heart attack. They know what heart attack is. They come to us early. They always know about what an angiogram, what a stent is, and all that stuff. But people don't give the due respect for this very common condition called high blood pressure. So I thought we'll discuss that and its serious consequence of heart failure.
Yes, sir. Now, when do we actually say that the BP is high? Do we have any values?
Well, that is a very good question, Vinod, because as you know very well, there is so much confusion within the medical fraternity as to what is high blood pressure. When is high blood pressure high enough to cause any problems? There is a lot of, there are a number of values that various societies have put through. The American society has a value, the European has its own value, the Asian Pacific has its own value, etc. Very recently, because of all this confusion, there was an international guidelines. World Hypertension Society came up with an international guidelines which is crystal clear as to what should be designated as normal and what should be high and what should be treated with tablets and what can be dealt with lifestyle changes. So all of this is very clear.
Okay.
And in that, a value of 130 over 85, the top value 130, bottom value 85. In a single reading, when a patient comes to you or me in our office, and sitting there talking to us, after a few minutes of relaxation, repeated measurements, if the value is 130, 85 or below, they do not have high blood pressure.
Okay.
Anything more than that, they have high blood pressure or they may have high blood pressure.
Okay.
At that point, there are various steps that we need to take, and we need to tell them you may have high blood pressure, but just rushing in to see me in a very busy outpatients where they think, oh, I may have a heart disease for some other reason, somebody referred them to me, would put their blood pressure up. That is not high blood pressure. So it's recorded as high on that point. So I tell them you may have high blood pressure. We need to do the next level of testing for high blood pressure.
Okay, in case now they see some doctor outside, their blood pressure is 140, 90, and they might have been started on tablets for some headache or any other symptom they have. Do we continue, or do we have to do any other monitoring or further evaluation for the BP readings?
Well, in terms of when to start blood pressure treatment, again the guidelines are very, very clear. If the first reading is 180, 110, at that point you don't wait. Okay, that is the point where we have reached the point of danger. If we don't treat that with tablets, that person will have a stroke or a heart attack or a kidney failure. So we immediately admit them, treat them. Okay, or we immediately commence a tablet. If they are not able to come into hospital, we start them on a treatment. Anything less than 180, 110, if we are recording for the first time, I wouldn't recommend tablets straight away. At that point, I would look at various levels. What are their coexisting risks? Do they have sugar? Do they have a previous stroke? Do they have a kidney problem? If they had a number of risk factors, yes, I might think, okay, this is not just an occasional reading. Their blood pressure is going to be high. And also we look at something called hypertension related damage, as you know very well, target organ damage as we call it. So evidence of any kidney problem, any protein in the urine, any ECG changes, any echo changes. So we see a number of things. The point I'm trying to make here is just because one BP is high, don't jump, and this happens very frequently. Don't jump and start them on a blood pressure tablet, because this is a lifelong treatment. So one of the reasons why people run away from modern medicine and go to naturopaths and homeopaths and all that is because we are a little bit trigger happy in prescribing. We just write a few drugs and give it to them because that's so convenient and easy. We should never do that. We should assess them and say, you may have high blood pressure, however, I would recommend these tests. And one common test I say is, go and buy a blood pressure monitor. It's very cheap. A good blood pressure monitor is 1,200 rupees on Amazon. A very good one, which I bought myself. Okay, a very good blood pressure monitor, which is affiliated, affiliated, there is a particular association which kind of labels these monitors as good. And this is a very, Omron is the company of that manufacturer, but there are a number of other companies which have the rankings and which have the labeling by various authorities, and they are very high quality automated blood pressure monitors. So home blood pressure monitoring in your own circumstances, at your own home, in the morning, in the evening, when you come back from work, when you have an argument, at any time, repeatedly do your blood pressure and bring a slip to me, is what I tell them. So I give my patients advice on lifestyle modification and say, eat less salt, do this, do that. We'll talk a little bit about quite a bit about lifestyle modification, but that's what I suggest to them. And then do a monitoring for the next 2 weeks at least, and do as many readings as possible. And don't do it at the same time all the time. Do it at different times of the day. Bring the readings to me. I'll have a look at the readings, and if in that I see that at least 20% of the values are way over the target, then yes, you have to start a tablet.
Do people have any symptoms for hypertension?
I mean, as you know very well, Vinod, blood pressure is such a masquerading condition that we seldom get any symptoms at all. And there are very, very few patients who say that they can feel that their blood pressure is high, and that is very rare, very, very rare. And so it is something that will be there. And one of the reasons the terminology that was coined, essential hypertension, is what people thought was that for that person, that high BP is needed to keep them active and running around. That was a kind of a 1980s concept. So they came up with this terminology called essential hypertension. But there's nothing essential about high blood pressure. Okay, high blood pressure is not essential at all. We want to get rid of it. Exactly. High blood pressure is high blood pressure. Hypertension needs to be addressed. It needs to be addressed. It needs to be managed, not always treated with 3-4 different tablets. So that's very important to understand.
We have a couple of questions. So I think we can take the questions.
Yeah, sure. Yeah, good. Yeah,
so
let's have a look.
One of this is, my BP has been high even on low salt diet. Do I need treatment? I'm 40 years old. Now the BP is 150/90.
Okay, so as we mentioned, 150/90 will be classed exactly on the borderline of grade 1 and grade 2 hypertension. Grade 1 hypertension is 150/90, up to 150/90. Anything more than 150/90, or rather anything more than 160/90 is going to be grade 2 hypertension. So 90 diastolic is something that I worry about because it's bordering on grade 2 hypertension. So somebody, a young person like yourself, has tried the low salt diet, but that's not the only measure. I always say 3 things for lifestyle modification for blood pressure. One is diet, in which there are a number of factors. One is very low salt, as low salt as possible, and there are a number of other dietary things that you would want to do. Low saturated fat, low red meat or no red meat. And if you do all of that, if you do a good dietary regime and exercise and stress management. So exercise, diet, stress management. Exercise, within exercise, aerobic exercise and some resistance training, light resistance training in the exercise. In the kind of lifestyle modification of stress management, meditation, swimming, yoga, music, therapy, whatever suits you, reading, whatever suits you. So all the 3 together, diet, exercise and the lifestyle modification for stress management. If you do all the 3 for 3 consecutive months, and if your BP is still high, you have to take tablets. So that person, whoever asked that question, whoever you are, if this is true for you, then yes, you may need tablets. But before we jump into that, all these are important. This changes if you have any other risk factors. If you are a diabetic as well, or if you have had any kidney problems, or if you have had a previous stroke, or if you have had previous heart disease, then clearly this changes because you need tablets straight away. That is the difference.
Now the concern is on the elderly population also, like more than 60 years, more than 80 years. Now as such, you were telling that we don't have any cutoffs for it, but I think we are more cautious on controlling the blood pressure in elderly geriatric population, right?
Yeah.
So even them, if it's going more than 160 by 100, we need to treat them.
Oh yes, definitely. I mean, there is enough data for that we need to try. We definitely need to treat them. I agree with you that they don't tolerate the treatment as well as the younger population, because the side effects are more common in older patients, which is our concern. Yes, we need to look at that. We need to balance that against the risk of stroke and heart attack, which actually is much higher in the older population. What we tend to do is that because the arteries become a bit stiff as we get older, and the population that you are referring to, they're very old, who are beyond 70, 80, the octogenarians beyond 80, the arteries are quite sclerotic, we call it, become very calcified and thick, and therefore the top blood pressure value can be a little bit high, normally high. So for them, the cutoff I use, and which is the guidelines as well, is 160. Up to down to 160, treat down to 160, below 160 I won't push it. I won't bring them to 130. So which is how we deal with that.
Okay, there's another question from a 45 years old engineer. He's working, I don't want to mention the place. He's telling that he doesn't have anyone in his family who has hypertension, but he's been detected to have hypertension. Why is that so?
That's a very good question. Why me is a question I never have an answer to. Because I mean, if I knew that, that'd be great, because I can go into a fortune teller and I'll make, no, I'll go into a different profession. Why me? And who will be that person who will develop that high blood pressure within the family is something we do not know. High blood pressure is a very diverse disease. It's got numerous reasons for that. There are a number of reasons why somebody's blood pressure can be high. The personality of the person, how they deal with stress, and the amount of stress levels is very variable within the family, and within your family the others may have a less stressful job, you may have a very high stressed job. Stress is one of the major factors. Pollution is another factor, as in if you are somebody who is a salesperson driving around in your motorbike, you're more likely to develop high blood pressure. So there are a number of extraneous factors, not just because it's in the family. Family is one important factor. If your family has high blood pressure, you are very likely to develop high blood pressure at a much younger age. But there are a number of other factors, your dietary habits, and diet wise, pickles are the worst that you can think of, and I love pickles, and I love pickles as well. I love pickles, and I have various forms of pickles at home. I kind of take tiny piece and I feel so guilty when I take the next spoon and I go, no, I'm not taking this. But it is one of Indian food is full of salt. All our food is full of salt, and we do have that Tamil so we say that. So if there's no salt, and for those of you who don't understand Tamil, what I was saying, if there is no salt in the diet, it deserves to be in the bin. So therefore we are born and brought up in a salt culture. We eat a lot of salt, and that is one of the reasons why high blood pressure, sweet and salt, we consume a lot of, and that's one of the reasons why high blood pressure and diabetes is on the rise in India. And India is the diabetes capital of the world, and now it's soon becoming hypertension capital of the world as well. So we have so much high blood pressure.
So in continuation with your stress, I think lack of sleep, many of them, I see a lot of IT and other people in different who work in shifts, they have a lot of sleepless nights, or they work during nights and they develop blood pressure.
There is
advice for them?
There is considerable data on shift workers and heart disease. Not only high blood pressure, all the heart disease, AF, atrial fibrillation, heart attack, heart failure, everything is more common in shift workers, particularly if they keep changing shifts.
But if that's their profession, what would they?
That's exactly. You can't do anything, because most of them work for American companies and they work for American Times or UK Times or European Times or whatever. You can't ask them to change their profession. So what I tell them is, try to see if you can get a consistent shift pattern.
Okay.
And once you get a consistent shift pattern, once you have finished your job, you must understand it may be 4 or 5 o'clock in the morning, and everybody might be awake and you might want to sit and chat with them and watch the telly. Don't do that. That's your night. Okay, so you have been up all night. So that's your night. So go to bed.
Okay.
So have a 6 hour of uninterrupted sleep. And that is so important. Just because you have had a couple of hours of sleep and then get up and run around and then come back and have another couple of hours of sleep, that is not right. That is not how the body is defined, is designed to work. So the body needs minimum 6 hours of rest continuously.
Okay.
So as long as you are doing it in that revised schedule, your body, your diurnal rhythm of your body will change, and then it will listen to the new normal and will accept the new normal. The problem is a lot of people have 3 months of this shift and 3 months of the other shift and the 3 months of that. That is horrible for their health, and that is something that even their employers need to look at and see that that is not good for their health.
We have now a couple of questions from. Should we name them?
Yeah. You can. Well, if you guys don't mind, if you are willing to give your name, then we will read your name. Yeah, it's there. Okay, we'll read the name.
From Mrs. Manorama, how to maintain a good blood pressure?
It's very, as I said, there are 3 factors for maintaining good blood pressure: diet, exercise, stress management. Diet, low salt diet, as low salt as possible, very low salt. Okay, they say there are 2 white poisons that Indians are addicted to, or 2 white drugs. We don't do as much cocaine as the Westerners, but we do enough and more of sugar and salt to compensate for the lack of cocaine in India. So yeah, sugar and salt are very, very bad for you as such, generally for everybody. Doesn't matter what your age, doesn't matter what your sex, doesn't matter how active you are, they are very, very bad. Particularly salt is very bad. Low salt in your diet, low saturated trans fat in your diet, almost no red meat, preferably no red meat at all, and no deep frying in your food. And I always tell my patients, dieting is very, very simple. Don't use refined sugar. Don't use saturated fat, ghee, vanaspati, butter, coconut oil. They're all saturated fat. Don't use them in cooking. Do not deep fry any of your food. Puri, bhaji, vada, chicken 65. Try and avoid them. So no deep frying. That is enough. That is healthy diet already. On top of that, a lot of fruits, vegetables, wholesome, organic, wholesome cereals, nuts, anything that you want to do with bran and a lot of fiber in your diet.
Also rotation of these oils is another concept which is coming from.
Rotation of oils,
like wheat bran oil or rice bran oil. No, they have rotation.
There are a few oils. There are a few. Canola oil is there. There are a number of oils which are healthy with lots of unsaturated fatty acids, monounsaturated fatty acids, some with polyunsaturated, but mostly with monounsaturated fatty acids. And you're right, rice bran oil is one of them. So most over the land, not under the land, groundnut and all this oil, avoid that. Most over the surface, vegetable based oils, they are good, and then you can swap them around. One very healthy and good oil is olive oil. It's a bit expensive, but it's a good oil to do cooking on, and it's tasty as well. So olive oil you can add on salads and stuff like that. But again, anything in moderation. Just because it's a nicer, healthier oil doesn't mean you can use a lot of it. So therefore it is olive oil. So diet, then exercise. Exercise, I always tell my patients, minimum 45 minutes regular brisk walking. This anybody can do. Anybody can do. So there's no excuse. You can't say that I live in a place I can't do any exercise. Okay, so you can walk for 45 minutes anywhere. You find a place nearby, and Bangalore is full of parks. So you can go to the nearby park. I know, with COVID it's been a difficult thing. With COVID, I've always told my patients, if you have staircases in your house, brilliant. Up and down your staircase 10 times. Okay, that is a very, very good exercise. Up and down your staircase 10 times briskly, very good aerobic exercise. Mild resistance exercise. Usual resistance is your own body resistance. So push-ups, pull-ups, sit-ups. These are good resistance, mild resistance exercises along with aerobic exercise. So combine these 2 exercises, and then use at least one, but multiple forms of stress busting. Reading books, listening to music, meditation. Simple things.
Yes. We have another question, interesting question from the Saroj P. Subbarao. Have heard some collapse suddenly and diagnosed as cardiac arrest. What's the difference between cardiac arrest and heart attack?
Heart attack, okay, right. There are lots of terms that common people, lay public, think are the same. They're synonymous. They're not. The kind of situation that you are explaining, where people are healthy and suddenly collapse to the ground and die, and this is a high profile. There are a number of high profile incidences where footballers have had, and some sports personalities, very healthy sports personalities, have crashed and died on the event or during training or whatever. That is called sudden cardiac death. That is an electrical disturbance of the heart. Commonly, they are born with a condition where their heart is designed in such a way that there is an electrical problem, aberration inside the heart. It's a huge field on its own. There are a number of conditions that can lead to that. And if that happens in a person, the entire family needs to be tested for a potential risk for that, etc. That is different from a heart attack. Whilst a heart attack patient can also suddenly die, it is not a common form. Commonly, heart attack happens when somebody has got a severe chest pain, sweating, palpitations, they feel unwell, and then that particular chest pain, you go to the hospital, you get an ECG tracing done as soon as possible. That picks up that this is a heart attack, and then we treat it. Most of the time we are able to fix the problem, and they have sufficient time to get to the hospital. Most of the time, 95% of the time, people will have sufficient time to get to the hospital with a heart attack, as long as you don't ignore your symptoms. So that is the difference between heart attack and sudden cardiac death, which is what you're referring to there.
Cardiac arrest and heart attack,
That's right,
I don't want to name the person who written this. The question is, I was a COVID suspect, now I'm negative.
Okay.
So I think maybe he was positive, I'm not sure. Now I'm negative, I feel more tired body, and how do I relieve the energy back?
I'll let you answer that question.
We do see a lot of COVID suspects and positive patients who develop a lot of fatigue and tiredness, body aches, and so I think it's going to take some time. It may take a couple of weeks to a couple of months. So as sir was also telling, aerobic exercise, daily walking, exercise, deep breathing exercise, I think it helps a lot, which we call as awake proning exercise. So that also helps the lungs to improve well. So that also you can do. You can lie on the left side of the body, like left lateral, take deep breaths for at least half an hour to up to 2 hours, then lie on the right side of the body. And the other one is like you can lean forward, then you can take a deep breath and you can breathe out through the mouth. So it also called what we call medically called as auto PEEP. So it helps in increasing the oxygenation of the lungs. Healthy diet, good sleep, I think that will help you to get back your energy back on, and hopefully you don't have any other medical conditions like diabetes and hypertension. Otherwise I think you should be getting back on your toes in some time.
That's an interesting one, isn't it, Vinod? So what would you suggest? Bending forward, taking a deep breath in
through your nose,
in and out,
like
several
a sleep breathing.
Okay.
Like
effectively pranayama, but do it bending forward.
Bending forward, so that we are
forward.
trying to use the larger muscles of the respiration to increase the capacity of the lungs.
Okay, so when you do that, your lungs expand much better, so the pressure inside the lungs are improved, so the lungs capacity improves, so you feel back to normal. So great.
There are a lot of symptoms of a COVID suspect, so I don't know any other system, like whether your lungs were affected or was it just fever. So I don't have any of those details, so I think this is...
It's a very common thing. I hear a lot of my friends who have been affected as well saying that they're calling me saying, I feel very fatigued. What do I do about it? And as you rightly said, it can last up to 6 weeks is what I read. So you said 2 months, didn't you? Up to a couple of months. So it can last up to 2 months. So don't be worried about it. And there are lots of, we see a lot of patients here with COVID, and Dr. Vinod has got a lot of experience. I don't deal with them that much. He deals with all of them on a regular basis. So, and we also see a lot of people getting better. A lot of people are getting better. A lot of elderly people are getting better. A lot of people with heart disease are getting better. So I think we must be cautious, I agree. But at the same time, we don't have to be scared. Okay, we can deal with this.
One most important, I thought it's an opportunity. Everyone please wear your masks, and we are a couple of people here including the cameraman. All of us are maintaining social distancing. Most often we see many people on the road, they still do not wear masks, they are coughing and sneezing. I think it's high time that everyone takes responsibility and wears masks and take care of each other's health. So this proceeding with, we have some more questions from Mr. Abhishek Kumar. Please say about diabetes effect on heart's health.
That is a very, very good question. Yesterday I was looking at it. There is a score calculator. I don't know if you know about it, Vinod. There are a number of risk scoring calculators. For those of you guys, audience, who are internet savvy and do a lot of Googling up, look for Q risk 3. Q as in the letter Q, Risk 3. This is a scoring system which, as a GPs, they used it in the UK, and I've trained and worked in the UK for 17 years, and the UK GPs use this Q-risk score, and it's designed to look at a number of factors about your health and tell you what is your 10-year risk of heart attack.
Yeah.
And that scoring is actually very, very good scoring, and I use it regularly in my OPD. If you put all those parameters in that Q-risk score, you tick diabetes and then untick diabetes, the percentage goes up phenomenally. There is a doubling, there's a 100% increase in risk between a diabetic and a non-diabetic. And in India, we take diabetes so easily because everybody is a diabetic. There's so many diabetics around. I know, we have an epidemic of diabetes. But what that means is that we have a very, very high risk population who are likely to have heart attack. I don't want to scare you all, but it's very important to know that the moment you're diagnosed with diabetes, your risk of heart disease doubles, as opposed to when you were not a diabetic. So therefore, it's very important to watch what you eat, to do the regular exercises, to go on appropriate medications. One of them is a statin tablet. If anybody told you, particularly if any non-modern medicine doctors or non-modern medicine people tell you that, oh, that statin tablet, don't touch it, it's such a horrible thing, or give you anything negative about that tablet, there is so much positive about that drug that the negativity is tiny. I wouldn't even bother knowing about it. I would immediately go on these medications and try and bring your risk down dramatically.
Especially I think in a diabetic population,
absolutely,
many of them still ask, like, I don't have cholesterol, but why do you start on cholesterol tablet? And many of them stop it because one, they don't have symptoms in the first place, and second, it's an additional tablet in the prescription. So one of the problem worldwide, but particularly in India, is that we don't take prevention seriously for anything for that matter. Our politicians don't do anything about COVID until the COVID comes and hits us. So we wait and then we do troubleshooting. And then we wait for the house to go on fire and then we go call for the fire engine. So we don't do preventive treatment, anything properly. However, if you look at the cost effectiveness, and India is always focused on cost effectiveness, isn't it? Anything we want, we always want it to be cost effective. We want the best deal on whatever it is. It's a good thing. It's being prudent. That's what it's called. So you're prudent about your spending your money. If you're really prudent about spending your money, you will spend on healthy lifestyle rather than hospital bills. And therefore, it's very important to focus on primary prevention, which is preventive medicine. And so that is, as I say, if you're a diabetic, your chance of developing heart attack or your chance of developing heart failure, everything goes up significantly if you do not take appropriate precaution, which includes treating the diabetes, treating coexisting risk factors, high cholesterol, uric acid levels in your body, kidney problems, whatever it is, treat it properly, regular medications, regular health checkup, regularly visiting your cardiologist, visiting a diabetologist, making sure you're on top of your diabetes. That's great. Yes, sir. We have another question from Mr. Manoj. He's 38 years old. He's on telmisartan 40 mg. My BP is always at about 130/80. My question is whether I can leave the tablet in future if I follow a diet and exercise on daily basis.
Yeah, there are a lot of my patients ask me how long do I take this tablet for. And one thing I started off this discussion, if you have logged on later on, whoever logged on later on, I started off this discussion saying that once you commence somebody on high blood pressure tablet, it's for life, and therefore we will be very cautious about commencing it. So yes, if you take a tablet and your blood pressure is now normal, it is because of the tablet. If you stop the tablet, it is bound to go up again, and therefore you have to be extremely careful to come off the tablet. Some people have managed it, and those who have managed it are obese people with very high body mass index, having seriously significantly fat, and having managed to lose a lot of weight. That tends to bring the blood pressure down, and therefore they're able to come off their tablets. So, but if you had a family history of high blood pressure, if you were diagnosed to have high blood pressure, and one way of identifying those who can never stop tablet is to see if they have what is called target organ damage. If they had evidence that the high blood pressure is damaging various bits of their body, such as back of the eye, kidneys, heart, if any of that shows any evidence that the blood pressure is affecting that organ or has affected that organ to some extent, you will never be able to come off the tablet. I don't want to sound nihilistic, I don't want to sound negative. I want to be very cautious when I say that yes, you may be, but it's very important to know that the tablet is what is keeping your blood pressure normal. It's not that your blood pressure has got normal.
Yeah, the next question is also in continuation with what you were asking. Like most of them ask for regarding diabetes, hypertension, like whether they should continue tablet for rest of their life. This is by Mr. Anirudh. So, like as you were saying, yes, I mean I think we are very cautious in starting tablet for hypertension, but if they require it to control, I think it has much more long-term benefits in controlling a blood pressure rather than taking a single tablet for rest of their life. It's like age healthily, because there's many people, like there were also a couple of months back there was one boy who was about 40 years old. He was known to have hypertension. He had accelerated hypertension, stopped medication for many months, came back with a stroke.
Yep.
Now it took almost 6 months for him to get back on his toes, but I mean thankfully he got better. But I think the devastating effects of hypertension is going to be very scary.
Absolutely. I mean that is the point. That's the point that we need to understand. So what we are trying to do is to prevent a serious consequence, not just the number. It is not just the BP as a number that we are worried about. We are trying to prevent a serious consequence of a stroke or a heart attack. So when you decide that, okay, I've had enough of this, I'm not going to take this, or I listened to that person said, you know, I'm taking carrot juice or this thing is going to make me better, I'm doing that, so I'm going to stop all these medicines, which some people do that, you're risking stroke, heart attack, heart failure, kidney failure, serious conditions. So do not go down that route. Yes, taking tablet every day makes you feel a little bit ill, makes you feel that I'm not healthy, but stopping the tablet and becoming genuinely unhealthy, genuinely ill is what you're risking. Therefore, you want to be very careful. The other thing, whenever we write a prescription, if we say 3 months and come back in 3 months to see us, it doesn't mean that you stop the tablet in 3 months.
Yeah.
It just means that you come back in 3 months, we check and see is that okay, if you need more tablets or if you need more adjustments of this or that. Lot of patients tend to think that it's a 3-month course. It is not. BP, sugar, high blood pressure, diabetes, heart disease, if we give you a tablet, until we stop it, until we say that that's got away, that's better, that's got better, or that's gone, we can stop. Do not stop the medications.
Yeah. We have another question. Is mustard oil better to be used rather than apart from vegetable oil or groundnut oil?
Mustard oil is not a bad thing. I mean, there are a number of various, as I started saying, there are a number of oils with various benefits and negative sides to it. The oils that have lots of saturated fat, you should stay away from. Coconut oil is one of them, very popular oil which a lot of people use for cooking and frying and believe it to be healthy. It is not. And I have very first-hand experience of coconut oil being very unhealthy, in that during my PhD in the UK, I was working on the beneficial effects of fish oil in heart rhythm disturbances, and it was a very sound, scientifically sound experimental process where there was a clinical as well as an animal model, and in the animal model, rats, with male Wistar rats, white color rats, they were fed food that was fortified with fish oil, and as a comparator, I needed some oil to put on another food. So I did a research and I found out that the worst that I could choose was actually coconut oil. I put coconut oil on that food, and then I was blinded to which rat was fed which diet. Okay. And then I had to do the research.
Okay.
But every time the rat was sacrificed and the heart was taken out,
okay,
the moment I see the heart, I know which rat had which oil.
Okay.
Okay. The rat which was fed with coconut oil was full of what we call as pericardial fat.
Okay. Yeah.
Epicardial fat.
Epicardial fat.
So the epicardial fat was around the heart. It was covering of white, yellow fat.
Okay.
So that much fat, and inside the arteries full of clot and blood clots and cholesterol. So coconut oil, whatever people tell you, do not believe that, is not a healthy option.
Yeah,
okay.
But the ethnic groups which are like born and brought up with coconut oil or gingerly oil or like a group of mustard oil Like, how do we change that?
Well, you
they've
can
been going for years together.
Yes, you can change that by mixing and matching, and you can use your favorite oil, a little bit of, and use the more healthy oils. A lot of things we change. Lifestyle is something that is a progressive thing. We all, human beings, we all change, and change is the only thing that doesn't change. So we all change as we go, as we grow, as we learn, as we know more, we change. And this health awareness in Indians is a very recent phenomena, because previously when I was doing my MD about 15 years ago, 20 years ago, nobody was as aware as they are now. So we as a society have become more and more health aware, which is a good thing. And just being aware is not enough, you need to practice. And therefore it is important to know that this is not a healthy option. And then if you knowingly choose an unhealthy option, there's not a lot anybody can do for that, out of taste or out of preference, if you want to do that. The question was about gingerly oil, mustard oil. Mustard oil. Mustard oil is okay. Mustard oil does have a bit of monounsaturated fat, but not much. What we are looking at is, among the oils, which is the healthiest? And there are 4 or 5, which is canola oil, olive oil, rice bran oil. Yeah. These are the oils which have quite a bit of monounsaturated fatty acid, and therefore more healthy on your heart.
Sure. There's another question from Mr. Saroj Pisubarao. The so-called organic vegetables, foods, etc., do they help in controlling hypertension?
Well, the corollary is the non-organic, the GM crops, the genetically modified crops, are they bad for health? And there was a huge discussion for a decade long discussion that was going on the genetically modified crops. They are here to stay. Whatever you get in your supermarket shelf, most of it is genetically modified. And so that's what we are going to get. Whether growing things in your garden, and you and I know that, when we are both very keen gardeners, and we both try and grow our own vegetables in the back of our own houses. Fortunately, we have some. We've been given by God some space to do that. And but yes, it is definitely a good thing to grow your own vegetables or buy organic vegetables if you can, because the genetically modified ones and the ones where chemicals have been instilled in will have number of health risks, whether it is heart or other organs, and particularly cancer is something that is being frequently talked about these genetically modified crops and non-organic pesticides and stuff. I am a very keen enthusiast of organic stuff. I believe it's very healthy because there is nothing that is toxic in it. Are they toxic to the heart, these crops that you get? Are they toxic to the heart? And just by eating organic vegetables and organic fruits, are you going to be very heart healthy? I do not know the exact answer to that, because I haven't seen a direct link between the non-organic food stuff that is available and heart disease. But a lot of talk about cancer, I think, and other health risks. Dementia is another one. So Dr. Vinod will know more about that. But organic crops are definitely good.
We have another question. I think we're running out of time. I think I'll finish it fast. Is low sodium salt better compared to the normal salt?
Yes, the low sodium salt is nothing but potassium based salt, and you have to be very cautious. It certainly has low sodium, and sodium is the main culprit here for high blood pressure. And therefore, if you have high blood pressure and nothing else, and if you're otherwise a very healthy person, yes, use low sodium salt. Because
I think many of them, if they have combination of kidney issues, then the potassium is going to be a problem, especially in those populations.
Absolutely, it's very important. If you don't, you need to ensure that your kidneys are okay. You need to ensure that you don't have other heart conditions such as heart failure and heart electrical disturbances, where the increased potassium in the salt can be a danger. But if you have nothing else but pure high blood pressure, and you are using salt and you love your salt and you can't eat your food without salt, yes, low sodium salt is a good option.
Now coming back to the hypertension, heart failure, like what are the common symptoms they will develop and how would we manage them? Is there any tablets or do they need surgery?
As we said, high blood pressure almost never causes any symptoms until it causes a major consequence, major result of high blood pressure, which is a stroke or a heart attack in itself. Heart failure is increasingly prevalent. People don't know they have it because they take it as part of aging or feeling generally tired, whatever. Common symptoms of heart failure: number one, breathing difficulty. If you're struggling with your breath to do the same job that you could do 6 months ago comfortably, please come and see one of us. We will do some tests and see is this heart failure or not. Number one. Common symptom, that's a very common symptom. Breathing difficulty in breathing while doing your day-to-day activities or while doing something strenuous, physically active. That is a common symptom of heart failure. Waking up in the night to go to the toilet very frequently, feeling undue tiredness, sweating a lot, number of symptoms that you can get from heart failure. The commonest symptom is breathing difficulty. The sign, the thing that watch for is your legs swelling. If you're developing leg swelling, it may not be heart failure. Yeah. Not all people with leg swelling have heart failure, but leg swelling, the puffiness in the leg and face is a common feature of heart failure. If you get that, it's also a feature of kidney failure, and it could be due to low protein, it could be due to a number of reasons, but it's a common sign of heart failure, and if you have that, please get it checked out.
How well can we control heart failure? If now, say it's already developed, now do we have medications?
Oh, absolutely. Absolutely. Which is why I started off saying that it's so important to identify early and treat it. Both high blood pressure and heart failure, if we identify early and treat, we can slow the progress of the disease. Yeah. Unfortunately, as of today, there is no cure for these conditions. These are called chronic illnesses. They are there to stay with you, but you can learn to live with them. And you can learn to live healthy with them. And the way you do that is to take regular medications and do all the lifestyle modifications we talked about. Yes, heart failure can be very effectively treated. There are a number of new drugs that have come for it, and there are a couple of very new drugs, and most recent one that's no longer very recent. Yes, that's been around since 2016, so it's no longer recent. There's a drug called Vericiguat, which has come in recently. So there are a number of drugs, and then the SGLT2 inhibitors, empagliflozin, dapagliflozin, they are used in heart failure. Yeah. So there are a number of drugs, number of tablets, medications which can be given, and heart failure can be treated. Not all heart failure patients will need a procedure or a surgery or a pacemaker, whilst pacemakers and specialized devices, specialized implanted devices, and I'm one of the specialists doing those things, and I enjoy doing them. I like doing them because I believe I'm good at it, and I believe that it helps a lot of very ill people. Whilst that is there, but a large proportion, 80-90% of heart failure patients can be treated very effectively with simple tablets if they come to us early. So if you have any symptoms that I mentioned, breathing difficulty, shortness of breath, as I told you, swelling in your legs, waking up frequently at night to go to the toilet, puffiness of your face, tiredness, lethargy, lack of energy, if you have any of this, check it out. It may not be heart failure, but check it out.
Yeah, we have another question regarding the common ones of pregnancy and hypertension. I think she's about 8 weeks pregnant, so she's found to have BP of 150/90. Does she need treatment, and what's the effect? How much to
pregnancy and hypertension is a completely different territory, and there are two major issues with that. We call it pregnancy-induced hypertension. It happens at the second trimester or after the second trimester, not before, of pregnancy. That's called pregnancy-induced hypertension. And there is another situation where somebody is known to have high blood pressure becoming pregnant. What do we do? There are two different situations we are looking at. A high blood pressure patient becoming pregnant, or a normal blood pressure patient becoming pregnant and realizing that they have high blood pressure during pregnancy. These two situations can be dealt with effectively. They need to be treated far more aggressively than the non-pregnant individuals, because there are two lives at risk, and also this leads to the pregnancy-induced hypertension, high BP during pregnancy, that leads to a serious consequence called eclampsia, which is fits, seizures, etc., and therefore has to be controlled very effectively. And the most important caveat here is that many drugs are contraindicated, cannot be given when you are pregnant. So therefore it is very important you see a specialist. And again, we in Baptist, we have a very active, academic, active gynecology department, obstetrics and gynecology department, and we work very closely with them. And I see a lot of these patients coming to us for regular medical checkups and treatments, and we very regularly monitor and get them through their pregnancy safely. The good news is a large proportion of them, 30 to 40% of them, will never develop high blood pressure in their life. It's just that pregnancy. After that, they'll be normal after that. Whilst the other 40-50% of them can develop high blood pressure later in life. So therefore, it is important to identify those patients and follow them up, etc. So if you have high blood pressure during your pregnancy, please seek specialist advice from a cardiologist who has a special interest in this area.
Yeah, we have another question. Having 1 clove of garlic on empty stomach with warm water, is it good for keeping your cholesterol and other things under control?
I mean, there are lots of myths in India. I don't know where we could pluck these things from the air, and this is coming from WhatsApp and all that kind of stuff. I have absolutely no evidence to say that any of these kind of home remedies that we hear, Zira water and mixed with ginger and garlic and putting a little bit of this yellow powder, the turmeric powder into it and all that stuff, and making a kashayam in your house. And the other day I was walking out for a cup of tea, and then the coffee shop in the trolley outside was selling a kashayam for COVID. So so in India we come up with all these kind of fancy ideas that somehow we can eat our way into health. So we think that we can eat some really bitter or really horrible or really non-tasty or really smelly stuff, and then we can become very healthy. I'm afraid there is no scientific evidence for that. I do not prescribe to that idea. I do not recommend it, and I'm afraid I am not one of those people who's going to say yes to that. One clove of garlic, unless the only thing it's going to make is to make your breath smell of garlic.
So I think we have to have a healthy lifestyle.
Absolutely.
Diet,
there's no
exercise.
shortcut. That's what I keep telling Vinod. There is no shortcut to a healthy lifestyle, and you have to work on it. You have to be consistent, and you have to, therefore it has to be practical. So a lot of people do this kind of crash dieting.
Yeah.
They go for a 6-week time of eating about 400-500 calories a day, and then they dramatically drop their weight, and then they pick it up within 6 weeks again.
Yeah.
It has to be practical, pragmatic. It has to be persistent. It has to be something that you can follow on a regular basis, and it also has to fill in with your normal lifestyle and enjoyable, because there's no point. Life is very short to constantly focus on something that is very unpleasant and keep doing that all the time. So it has to be pleasant, but at the same time it has to be sensible. So you can identify what is your wise and what is your focus, and work on that. If you like ice creams, so 2 ice creams a week, but after you have had your ice cream, go for a long walk or a run, burn it off. As simple as that. So work in a very sensible way.
That for diabetic also?
Indeed, yes, yeah, whatever. Okay.
Okay, I think we are coming to the end of our session. I think it was a very valuable discussion we had. I hope it encouraged the audience and increased the awareness among all of them. Thank you, Dr. Saravanan.
Thank you, Vinod. Thank you for this evening as well. And thank you all of you for joining us this evening. I hope it was useful for you. Feel free to send any questions from now on as well on our Facebook page. And our administrators here, there are a number of them who are looking at it. So we will respond to you, both Dr. Vinod and I, depending on whose specialty it falls into. We will be very happy to give you responses. So send your questions in through the Facebook, our Facebook page, and then we'll respond to it. Thank you for joining us.
Thank you.
Thank you, Vinod.